In today's episode of Can ChatGPT Be Your Doctor? I, Dr. Monica, a board-certified OBGYN, am going to test out one of our AI platforms to see how they respond to being asked questions that women will commonly ask about women's health. So today, I usually check out ChatGPT, but I ran out of free questions. So we're going to do Grok today. We're going to do a doc versus Grok. And the question I'm going to be asking about is endometriosis. So how do I know if I have endometriosis? It seems like a pretty reasonable question that someone might ask. Okay. So first off, they say endometriosis can only be definitively diagnosed by a doctor, usually through laparoscopy, which is a minor surgery to look inside the pelvis. So this is true. The endometriosis is, although often a clinical diagnosis in a presumptive manner, so someone has the symptoms of it, we think they have it, we don't go straight to doing a surgery, but the gold standard for diagnosing endometriosis is a laparoscopy, so Grok was right about that. One thing they didn't mention is that technically to truly meet the gold standard definition of the diagnosis, not only does it need to be seen at the time of surgery, so like laparoscopy, but you would also need to take a tissue biopsy of the endometriosis implants and have that confirmed by a pathologist. So this is pretty spot on for how you actually diagnose this, although to be pretty specific in what real world physician would find important is that you do also have to get that biopsy to get that diagnosis. So Grok is going straight to the diagnosis with the laparoscopy. I think to answer the question I asked, which is how do I know if I have endometriosis? And yes, that's how it's diagnosed, but it's also giving us a lot more information about endometriosis. So let's go through that. So it's talking about common symptoms. So painful periods, and it describes what that is. Definitely part of endometriosis. Chronic pelvic pain, and it mentions pain outside of periods, which is really key, as well as in the lower abdomen and the back. Pain during intimacy, that is something that is definitely a part of endometriosis, and it describes that a little bit more. Pain with bowel movements or urination, especially during periods, that is also a common symptom because of the possibility of endometriosis implants in the bowel or the bladder. Heavy or irregular periods, it says bleeding through pads and tampons hourly or unpredictable cycles. I wouldn't relate this as much to endometriosis, and I certainly wouldn't just chalk up irregular periods to just being endometriosis. Endometriosis is generally more of that pain and that discomfort and the organ dysfunction associated with the period and because of those implants, but it shouldn't make a big difference on the timing of the period. That would require a little bit further workup, and the heaviness also a little bit further workup as to why it's heavy. Make sure there's not a bleeding disorder or other type of problem. So those two symptoms I don't think are as spot on for endometriosis related, especially not without ruling out another cause. Whereas so far the other things that Grok has mentioned are very spot on hallmark symptoms of endometriosis. Next symptom mentions infertility. Absolutely, by a multimodal effect, endometriosis has an effect on fertility. GI symptoms and fatigue. So GI, of course. So if there's endometriosis implants within the bowel, which is absolutely possible, and I have seen quite a bit of, there can be bloating, diarrhea, constipation, just upset, irritable bowels because of that endometriosis. So I think a good list of the symptoms, with the exception of the heavy and irregular periods, which I think warrant their own category and I don't find as related to endometriosis. So now it's providing some self-assessment questions, quite in depth. So it's saying to ask yourself, do my period cramps stop me from going to work or school? Do I need strong painkillers? Does intimacy hurt? Have I been trying to conceive for 6 to 12 months with no success? And do symptoms worsen over time? It says if yes to 2+ to see a doctor. I think that's fair. I think it'd be unlikely to have any one of these on their own. Now, some people will have pain with intimacy on their own from different causes, so that could be one thing all on its own. That might point a little less closely to endometriosis. These other, and certainly infertility can have a different cause besides endometriosis, so sure, if that's on its own, that might not point as much. So I think saying yes to 2+ is pretty fair reason to prompt, but also any one of these is a perfectly good reason to come see a doctor. Steps to getting diagnosed. Let's get all into this. So it says track your symptoms, see a gynecologist, and then some tests to expect. So let's see how Grok would work up possible endometriosis. So it's saying a pelvic exam, of course. Ultrasound, yes. MRI, not often we end up doing that. So endometriosis is difficult to see on imaging. It's possible in some cases, mainly with an ultrasound. You may see it with if they have an endometrioma. So that's a mass on the ovary that's all made of endometriosis, and that would be something that would cue you on that they may have it. But just seeing the little endometriosis implants are very difficult, and most of the time an MRI is not really part of the workup. If it's getting to that extent, I think most of the time we'd end up just taking a look with a laparoscopy. And it does mention that laparoscopy is the gold standard. Oh, and it mentions the biopsy. Grok redeems itself. It does say that laparoscopy is the gold standard for diagnosis and that a biopsy confirms the tissue outside of the uterus. So well done, Grok. Well done. It mentions some red flags, which is always good. And it says some common misdiagnoses. So one is to say that it's just normal bad periods. Thank you, Grok, for pointing that out. Yeah, sure. Most people have some type of discomfort with their periods, but I do think a lot of people just assume that bad, horribly crampy periods is just normal for them. So I like that Grok has said, that's not really normal. Go get that checked out. IBS, irritable bowel syndrome, I mean, that certainly can be something that it's confused with. Like we mentioned, with all the possible endometriosis implants that can be in the bowel, that can completely mimic irritable bowel syndrome. And also, you can have two things at once. So you could have endometriosis and have IBS. But it's good to determine for sure which is which one you have, because they're treated differently. Pelvic inflammatory disease. Yes, this has pain associated, but a lot of other different symptoms, and that can actually be treated and cured. And then he mentioned adenomyosis. So adenomyosis is a less commonly known condition where instead of the tissue from the endometrium being outside, which is endometriosis, it just works its way into the musculature of the uterus. And sometimes we'll see them coincide, like they're both present, endometriosis and adenomyosis, but adenomyosis can exist on its own. It's going to have very similar symptoms to endometriosis. And then the next step, so see a gynecologist, definitely. Bring a symptom log. I love that. Sometimes it's easy to feel like you have an idea of what's going on, and then you get to the doctor and they ask all these specific things and you're like, I'm not quite sure of those specifics. So having a symptom log, a period tracker app, or a period tracker log can be really helpful so that you have all that information ready to go through and talk about with your doctor. To advocate, if you're being dismissed, to say my pain is disabling, I'd like a referral to an endometriosis specialist or laparoscopy. I mean, certainly, the hope is if you went to a gynecologist with your main complaint being that your periods are painful, there's no reason not to have that looked into or treated. Now, what I will say is that after going through this whole response from Grok, the impression I think someone could take from it is that if you think you have endometriosis, you go to the doctor, you're going to get a laparoscopy to diagnose it. And that's not really how it's done, because we would be doing laparoscopies on everybody. We'd be putting patients through all this risk of surgery. It'd be really excessive risk. And a lot of times it's not necessary because, like I mentioned earlier, if we think you have endometriosis, we'll go ahead and treat you and try to get you feeling better. We usually reserve laparoscopy for if you've failed a few treatments or if maybe we're not exactly sure what's going on. It's not something that we jump to right away. So I would say I got a little bit of that impression from Grok's answer that that's going to be what we do right away, and it's not. So I wouldn't expect to immediately be offered a laparoscopy, even if you've maybe tried one or two medications for treatment. Usually this is something that we do a little bit further down the line. Grok has also provided a bottom line. You can't self-diagnose, but severe cyclical pain and other symptoms means see a specialist. Laparoscopy is the only way to confirm. Again, don't push the laparoscopy too much. We don't want to put people through surgery they don't need, although, Grok's definitely right about the gold standard of diagnosis. And don't suffer in silence. Early intervention improves outcomes. I love that ending. Thank you, Grok. That is a great take-home message to end the response with. So I say overall, this touches on a lot of really good points. It touches on all the symptoms that, people might not immediately think of when they think of endometriosis. They may think of just pain, might not be aware of the pain with intimacy or the infertility or the other associated symptoms that come from having implants elsewhere. So it really laid out a nice run of the reasons that you might be suspicious of having endometriosis. I do think it was a little heavy on the laparoscopy, but I'm proud that it knew that that is the gold standard way to diagnose, and did mention the biopsy later on. Further down the response to that looked good. So I'd say for today that Grok, ChatGPT AI did an okay job at being our doctor, made some good recommendations and knew a lot of good information, and nothing harmful that I saw from it. So I think that was overall a pretty good response for that particular question. So I'll be making some more videos about how AI can sometimes be our doctor, and I'll be reviewing those responses. Drop a like if you enjoyed this content, and that'll help others find it too, and consider subscribing to my channel where I talk about all different topics in women's health. I'll see you next time.